Well, good afternoon. Thank you very much, Nick. Just wanted to start with just sort of the provincial statistics. Today, the numbers were at 114. We had no cases in our area. Again, we're really low in our cases. I'm not even going to bother showing the graph. We've got no admissions, no outbreaks.
Recording in progress.
No outbreaks in our congregate settings, and we have no hospitalizations currently, which is very good. Ottawa had no cases as well, I think, reported, and Toronto low cases as well. So overall, I think the numbers are in the right direction. As you do know, and you've heard that. Because of the low numbers and the increasing vaccination rates, both locally and provincially, which I'll talk about a bit later, we are going to be entering into step 3 on Friday at midnight this coming week, and so that's about 5 days earlier. I think that that's a testament to two things. Number one, that we've worked hard to keep those numbers down in terms of the COVID cases, and secondly, obviously, we've ramped up our vaccinations moving forward. So I think that's a very good sign. Again, it's going to entail increasing activities outdoors, increased numbers of activities, increased indoor activities, and so I think it's a one step closer to a normal, not fully normal. Masking still going to be required under most circumstances, physical distancing, and so on. But there will be more gatherings, particularly outdoor gatherings. There'll be a significant increase in indoor gatherings, indoor events, indoor dining, and so on. So this is a big step in my mind into normal, going back to normal. However, we need to be careful, and just to make sure that we're just keeping an eye on those numbers and the variants, of which, again, we still have not had any in our area, but we know that they're lingering in Ontario, particularly the Delta variants. A few other things I want to talk about. Given those low numbers, I had a meeting with our hospitals last week. Our hospitals are the ones that are running our assessment centers right now, and they're in the process of moving back, pulling back some of the activities of testing, and that those will be announced as they come out. But certainly the numbers are down in terms of testing, but we still want to have the ability to increase our ability to test. Should that require, hopefully not. And so a few other questions before I go on to the vaccine numbers, which I want to share with you. Again, questions about vaccine interchangeability. We've had both Moderna and Pfizer interchangeable. For the most part, most people are okay with that. We think that they are interchangeable, the two mRNA vaccines, and we have not had much of a pushback or anything like that. But again, we have clinics that offer both. We have clinics that offer one versus the other. Depends on our supply. Our vaccine supply will be good moving forward. Our Pfizer supply will increase, as will our Moderna supply. So that's another thing that I want to talk about as well and cover. So now I'm just going to share with you right now our latest statistics, which I sort of grabbed from the ministry site that has this. I'm just going to, sorry about that. Move that this way. There we go. It's in my way. There we go. Okay, so as of yesterday, we have almost vaccinated administered almost 220,000 vaccines, and you can see we're approaching the 79% mark of 18 plus and the 77% mark of 12 plus, with 140,000 people having it at least first dose, and 78,000, almost 79,000 people having received a second dose, which brings us closer to the 50% mark. And then it's lower in the 12 plus, as you see. Again, this is just this graph here is a very interesting one. It just gives us the rates of COVID infection, and then as it goes down, as our vaccines went up. I think that part of this initially, because the vaccine levels were lower here, was really due to public health measures that were adhered to, stay-at-home order and so on. But then you can see, as we in a combination of overlap of both of the effects, you can actually see right here that as we increase the vaccines given to the public, you could see that those numbers went down as well. So I think that's a very good sign. So like I said, we're now approaching that 50% adult second dose, 78,000 total people. We need to have at least 130 to 140,000 people vaccinated with both. One of the things that we're looking at in terms of moving on beyond step 3 to even more opening or even much less restrictions is the ministry has thrown around some numbers: 80% first dose, 75% second dose, and no health unit less than 70%. Anyway, so we're approaching those. That's why I'm gauging those, and it's for 12 plus. So that's what I'm looking at. And I do know that if we look at a 75% second dose rate, we're looking at about 135,000 people or so having 2 doses out of 181,000 that are eligible, 12 plus. So you can see that with the rate that we're vaccinating that right now, we will be approaching a high enough level of second doses by the end of July with our clinics moving forward. This next one here gives us again a breakdown of the percentage by age, percentage vaccinated, and obviously you could see the dark blue here are first doses, and everybody over 30 is in the 70% range, and you could see that we're still struggling with the less than 30s, although they've gone up a bit, both in the 12 to 17 and the 18 to 29 age group. You can also see that, again, we're up to almost 80%. We're in the high 70s for 70 plus adults in second dose. And again, that is something that I'd like to talk about here. Number one, we still have about 20% here or so of the population, the older age groups that require their second dose. And if you have been given your dose, many of you received those vaccines back in April, and you were given an initial appointment in August. But you know what? You can come. You can change it. You can change it and come earlier. That would be great. And then for those the younger individuals here again who have who are still lagging, again, we're making it quite easy for you. You can do walk-in clinics if you're from our area. You can have a standby list. Pharmacies have it, and so please. The message now is we need to get up to that crucial number that will then allow us to go even beyond step 3 into lifting almost all the restrictions. So that's our goal collectively, and I hope that we can all embrace it. And if you know anybody that hasn't been vaccinated, please urge them to get vaccinated first or second dose. We'll make it easy for them across our area. Again, available in pharmacies 7 days a week, available through primary care and through our mass immunization clinics, of which we have 10, 12, 13 per week, and continue between now to the end of July on a very regular basis. So this just gives you an idea of how many vaccines we administered. So in June, we administered 81,000 total, and you could see already the first 10 days of July, we've already done 25,000. That's actually the first week or so, because yesterday we didn't have a clinic, so which is good, a good rate. And again, I want to be up there. And if again, we'd really like to reach, having vaccinated about 320,000 people. Yeah, it's 135. Anyway, I had calculated it. We're going to be putting out the actual numbers and sharing it with people, but you can see where I'm going with that. We are, approaching that mark of wanting to vaccinate at least, 280,000, 260, actually it's about 260,000 people. It's 135,000 is about 75%. I'd like it more, but that's the minimum that we would want. You can also see that our first doses here are 79%. And again, we delivered most of them during April to middle of June. And then, not surprisingly, now we're up to almost 79,000 second doses, most of which, again, are given June and on. And you can see that already in July, we've administered 23,000 vaccines, second doses. So the bottom line is that we are doing well. We just want to continue. Like I said, there is a bit of a lag in some of the younger age groups. And again, we also have some work to do for the elderly to get their second doses, but that's increasing. And we do have appointments. We have appointments all the way through. Like I said, there are clinics available. And we have a walk-in opportunity. So please, I know it's summer and I know it's a vacation time for a lot of you, but it just takes very quickly. Our clinics are efficient, go in and out, and we can, like I said, the quicker we get to that higher number, the better it'll be for all of us. Bonjour tout le monde. Je vais commencer avec les chiffres ontariens. On a augmenté de 114 cas depuis le jour précédent. Ça, c'est c'est un chiffre qui est très bas. Ottawa avait 0. Nous aussi, ça fait quelques jours qu'on n'a aucun cas. On a vraiment des 0 à 1 cas par chaque quelques jours. Donc, ça va très bien. On n'a aucune flambée. On n'a aucune patiente hospitalisée dans notre région. Et aujourd'hui, il n'y avait aucun décès en Ontario aussi. Ça, c'est des bonnes nouvelles aussi. Toronto, il y avait à peine 10 cas. Peel, 9 cas. Grey Bruce et Waterloo avaient 18 et 15 chacun. Et voilà, ça, c'est le Delta qui était la cause des flambées là-bas. Pour nous, on va continuer comme ça va très bien. Au niveau de vaccination, on va dans le bon chemin aussi. Donc, à cause de tous ces chiffres qu'on voit qui vont dans la bonne direction, nous allons rentrer aux étapes 3 cette semaine, soit vendredi, à minuit et 1, soit le 16 juillet. À ce moment-là, les activités à l'extérieur, il va y avoir beaucoup plus du monde. On peut avoir beaucoup plus du monde à l'intérieur aussi, au cinéma, etc. Au stade, les sports à l'intérieur pourront commencer. Il y a une série de choses qui seront plus interdites, si vous voulez. Donc, ça va très bien, mais il faut continuer doucement, parce qu'on veut aller aux prochaines étapes après la troisième étape où nous aurons avec un pourcentage ciblé de première dose et deuxième dose, que je vais vous en parler. Avant que je vous donne les statistiques au niveau de vaccins, j'aimerais juste dire que nos centres de dépistage, on est en train de diminuer les heures de fonctionnement des activités. C'est une chose à suivre parce qu'on a une diminution de la demande, si vous voulez. Mais tous nos hôpitaux sont prêts à réaugmenter le débit et les jours de fonctionnement. Donc, ça va être listé sur nos sites web et une fois qu'on commence à diminuer. On a beaucoup de questions au niveau de vaccins, on pourrait changer un à l'autre, Pfizer ou Moderna. Les deux vaccins de mRNA sont semblables, c'est les différents manufacturiers qui le fabriquent. Donc, à ce moment-là, nous n'aurons pas beaucoup de difficultés. Nous avons des cliniques qui ont des deux. Nous avons quelques cliniques qui ont juste Moderna. Donc, il n'y a pas beaucoup de monde. On n'a pas beaucoup de problèmes avec ça, mais il faut continuer et de recevoir le vaccin qui est disponible pour vous. Mais il n'y a pas beaucoup de problèmes, mais il faut souligner qu'on pourrait le changer une à l'autre, Pfizer, Moderna ou Moderna, Pfizer. C'est effectivement le même effet, la même réussite au niveau de protection et les mêmes types de profils des effets secondaires qu'on pourrait voir. Donc, je vais vous démontrer ici une présentation attends, je vais aller plus haut. Voilà. Donc, on voit ici, dès hier, le 11 juillet, qu'on voit qu'on a administré presque 220 000 vaccins. Donc, 140 580 étaient première dose, soit à peu près 79 des populations 18 et plus, 77 pour la population 12 et plus. Et vous voyez ici qu'on a vacciné presque 79 000 personnes avec leur deuxième dose, soit 46 des personnes 18 et plus, ou 43 des personnes éligibles de 12 ans et plus. La raison pour laquelle je dis ça, c'est parce que euh, quand on voit comme qu'est-ce qu'on va cibler comme prochaine signe, si vous voulez, qu'on est prêt pour aller aux prochaines étapes, on appelle ça étape 3, mais moi j'appelle ça étape après, étape 4, j'appelle ça étape après 3, autrement dit, avec presque plus de restrictions. Ça, on n'a pas encore un chiffre officiel, mais pour commencer à penser à ça, il faut qu'on ait à peu près à 80% première dose avec toute la population, 12 ans et plus, et 75% deuxième dose. Donc, et au moins 70% de première dose dans tous les bureaux de santé à travers. On est là déjà. Donc, vous voyez, pour la raison pour laquelle je voudrais augmenter le débit avec le vaccin, on approche le 80%, donc on n'aura pas de problème pour la première dose, mais j'aimerais ça approcher le 80% pour la deuxième dose. Et vous voyez ici, ça nous prend, juste pour être à 75% de deuxième dose, on devrait être à peu près à 130 000 de vaccinés, donc on a besoin d'un autre 50 000 de deuxième dose de réussir ça. J'aimerais aller plus haut, mais vous voyez qu'on est proche, on pourrait le faire. Et d'ici le mois de juillet, je pense qu'on va être très proche de 75%, 70 à 75% deuxième dose, qui est une très bonne chiffre avec laquelle on pourrait progresser aux étapes après la troisième étape. J'aimerais ça vous montrer aussi. Ici, qu'est-ce qu'on voit? Je pense que c'est très intéressant. Oups, pas celle-là. Attendez, je vais retourner. Vous voyez ici, ça, c'est le troisième vague que nous avons eu. Ça, c'est les cas dans notre région. Et vous voyez ici, à peu près, on n'avait pas beaucoup de vaccins. Ça, c'est le taux de vaccins, bleu et vert ici. Vous voyez qu'on a eu, ça, c'est les personnes qui étaient vaccinées. Ça, c'est le début de deuxième dose. Et on voit ici qu'on commence à diminuer, mais vous voyez, on n'avait pas beaucoup de personnes vaccinées à ce moment-là. On était à peine 20%. Donc, tout ici, c'était vraiment la raison pour laquelle on voyait une diminution. C'était plutôt à cause qu'on avait les ordres de rester chez vous, on était dans un état d'urgence avec des confinements, etc. Donc, vous voyez ici, à un moment donné, il y avait un chevauchement ici qu'on commence à avoir une débit importante des vaccins qui approche 60, 80, 70%, 80% ici, vous voyez. Et à ce moment-là, vous voyez que les vaccins ont commencé à vraiment marcher et vous voyez une diminution et vraiment stable un très, très chiffre bas au niveau des cas quotidiens dans notre région. Ça, c'est bien sûr dans notre région. C'est pour ça que je demande à tout le monde vraiment d'aller se faire prendre son première dose, deuxième dose. Vous voyez ici, qu'est-ce qu'on voit ici, c'est que, oups, encore, ça, c'est le pourcentage de personnes qui étaient vaccinées par âge. Vous voyez, avec le bleu foncé ici, effectivement, les personnes plus que 30 ans, c'était 70% et plus. Et vous voyez, on approche le 99% ici, les personnes aînées. Vous voyez aussi que doucement, doucement, on augmente avec les deuxièmes doses dans ces âges ici et ça va progressivement en diminuant avec l'âge. Mais vous voyez encore, on est bas pour les personnes en bas de 30 ans. Donc, mais ça a augmenté un peu depuis la dernière fois qu'on a démontré ça. Donc, on le fait ça facile pour surtout les gens. Premièrement, si vous avez besoin de votre deuxième dose, allez-y. En dedans de 28 jours après votre première dose, allez-y, changez votre rendez-vous. On va vous donner votre vaccin plus vite parce que j'aimerais ça atteindre le deuxième dose élevée dans notre région le plus vite possible. Et des personnes qui n'ont jamais eu de premier vaccin, surtout les jeunes ici. C'est facile. Vous pouvez aller aux pharmacies, vous pouvez aller à votre médecin et vous pouvez aller à n'importe quelle clinique si vous êtes de notre région sans rendez-vous. Donc, ça, c'est facile pour nous. On va le faire facile, on va faciliter, on va enlever toutes les barrières pour que vous serez vacciné le plus vite possible. Donc, on continue avec les autres chiffres. Donc, vous voyez ici, on a presque 220 000 doses données en total. Et vous pouvez voir que déjà, en mois de juillet, à peine les premières semaines, on a donné déjà 25 000 doses qui comparent avec le 80 doses dans le mois de juin parce que le débit augmente, on reçoit plus de vaccins. Et on voit ici encore, on est rendu à 140 000, presque 79% au niveau de première dose. Et vous voyez, la plupart étaient donnés entre le mois d'avril et mi-juin. Et finalement, au niveau de deuxième dose, vous voyez qu'on commence à augmenter. On a donné 23 000 deuxième doses dans les premières semaines de juillet. Donc, on pourrait aller 3-4 fois plus. Donc, ça va atteindre une très bonne chiffre, à mon avis, d'ici fin juillet. Donc, encore, c'est très important de juste continuer à faire les précautions. On rentre dans étape 3 cette semaine, mais il y a encore des limites avec des masques, les distances physiques, etc., qui devraient être suivies. Mais en général, je pense qu'on va à la bonne direction. C'est bien sûr qu'on va faire attention parce qu'on a déjà les deltas à Grey Bruce et Waterloo et on n'a pas dans notre région, puis on ne veut pas que ça rentre. Donc, il faut faire attention encore. So I'm going to answer some of the questions that I've gotten here. One of them was about testing, and I talked about that. Another one was about vaccine interchangeability, and I have talked about that as well. And I have some non-COVID ones as well here that Greg Chamberlain has asked me. One of these is are we looking at another heat warning or not? Again, it depends on the weather. We have our daily alerts, and if we need to issue one, we will issue one. The West Nile front, again, at this point, we are doing our routine West Nile mosquito trapping. At this point, we haven't gotten any positive mosquitoes. Let's not forget that we're summer, so we have West Nile virus, we have Lyme disease, we have sun issues, water safety, all these things that are still important, and sometimes we lose. They don't have that limelight because COVID has taken it, but we still need to continue with that. And to me, that's important. Obviously, other issues that we're going to look at obviously is catching up on our vaccines and other things that we'll be doing as we're going out into recovery. But let's not forget again that we're summer, so it ranges from water safety, drowning prevention, boating safety, obviously sun safety. And barbecue safety, all these things that are in the summer, and very importantly, again, Lyme disease awareness, tick awareness, be tick aware, and also in terms of West Nile virus, in terms of mosquito prevention and how you can mosquito-proof your home and your area, by making sure that you don't allow water to gather or pool. And then the other one is with stage 3, are we going to look at section 22 orders? Yes, we're revising. We're actually got the regulations. So now we're looking at what section 22 order is not pertinent anymore, and we will be amending those as necessary. And then I have another one. Are there enough available appointments in the booking system for those younger age groups to be able to get the first dose and or advance the appointment of the second dose? Absolutely, yes. And that's the message. There is a lot of room, and there's a walk-in and so on. So particularly younger age groups, you can come in for your first dose, and we can give you your second dose 28 days, as soon as 28 days after your first dose, so we can get it done. And that's it for now, Nick. Let's take some questions from the media.
Okay, first question comes from Philip Blanchard, Morrisburg Leader. Go ahead, Philip.
Good afternoon, Dr. Paul.
Hey, Philip.
So my first question, vaccinations are still lagging for the 12 to 29 age groups, first and second dose. Access to transportation, especially in the more rural areas, is still an issue. As are parent work schedules. Sometimes there's only one parent that's working. There's only one car families and that. Is the EOHU planning on more rural or localized walk-in clinics?
Yeah. Yes, we are. Yes, we are. We're trying to look at that. We're trying to identify. We've got a few in Hawkesbury area. We've got a few more in those areas as well. If we do identify some, we will do some more pop-ups. We're doing those as well. We are working with the city of Cornwall as well to facilitate transportation, and we have asked on several occasions that we will revisit with some of our municipalities to facilitate transportation as well. So it's two ways. It's one, to facilitate transportation to our facilities, but also taking some pop-up clinics to those areas.
And anything in SD&G County at all?
Yeah, we're looking at that as well. Morrisburg, Winchester, those areas as well. Yes.
Because I know transportation is an issue in these areas.
Yeah.
So,
yes.
The second question, talking to some of our readers, people with second dose appointments that are farther farther away are leaving them rather than logging in and booking an appointment sooner. The feeling is that they log in and then not all the more up-to-date clinics are showing up there because of the loading with the province. So why bother moving the appointment up when they already have one? Do you feel this the booking system itself is and the lack of appointments sooner hindering getting jabs and arms?
Well, the thing is that a couple of things. We've got thousands now of available spots right now, and so there shouldn't be an issue with that. And to my understanding, that they are available to everybody, so they shouldn't give up. I would recommend the quicker they get it done, the better. I mean, they can even walk in, and if they feel like it, and get it done in a pharmacy, or whoever accepts walk-ins, they can get it done that way as well. So we're trying to make it as easy as possible for them to get their second dose, and obviously for those who are lagging or haven't got the first dose yet or are hesitant, we're trying to make it as easy as possible for them as well.
Okay, thank you.
No problem.
Next question comes from Amanda Pfeffer, CBC Ottawa.
Hi, Dr. Paul.
Hi, Amanda.
Yeah, hi. Long time no see.
Yeah.
I wanted to know if you, on the issue of testing, I have two questions actually. One is about testing, and you're ramping down testing. Imagine you're also on a body, I think, for all public health units. Can you tell me a little bit about where testing is at now, how it will go down, and perhaps maybe ramp up again in the fall? Can you tell us where we're at with testing?
Yeah, I can tell you that we have been discussing this both locally and provincially. Ontario Health as well has been looking with the hospital partners as well as to what the testing will look like now, because there's a decreased demand. So we're trying to find the balance between not doing it every day and redeploying some of the staff for other activities as we bring back more activities, and also the ability to ramp them up should there be required. There's also talk about perhaps them at one point being able to not only serve as testing centers, but also as real assessment centers for medical assessments, should the need be, should we get more increased cases or symptoms in the fall. So there's no concrete plan at this point, but they are discussing it both at the provincial and the local level for pulling back, not completely removing them, obviously, but also having them like an accordion type where they can just bounce back if required.
The second question is about the last push. So if you're at, do I understand that right? Is it 79% vaccinated of those eligible? Of those eligible?
Where we are now?
Yes.
We're 79% of 18 plus. 79% first shot for 18 plus, and 76% 12 plus.
And so have you done an analysis of who the last 21% is? Do you know and how to reach that group? I imagine some you're not going to get, but can you tell me what the analysis is?
Yeah, I'll tell you, in general, we know when we talk about vaccine hesitancy, about 10 to 15% are vaccine hesitant, and you'll be able to sort of sway them. There's a couple of percentage that will never, you're never going to sway. We have analyzed it, and most of the ones that are not vaccinating are the 30 and younger. And we're now trying to look at targeted ways through workplaces, making it easier for us to go in a workplace if there's a lot of young people there to vaccinate. We're also we're looking at some social media, even TikTok, those type of things to reach the younger age groups to be able to vaccinate. We've actually reached out to our municipalities to spread the word. We're also going to be working with our primary care practitioners, because some of the people who are hesitant, may want to hear from their doctors or their primary care practitioners. So there's a whole slew of things that we're doing. As a matter of fact, I've had meetings today and tomorrow about that, trying to address those. Predominantly, they're the younger age group, because if you look at our numbers, they're 30 and younger, and we're trying to get the older ones that are still, but it's not much for us to do the older ones. We're at 90%, 80-90%. So it's more the younger ones.
And just finally, in terms of reaching out to them, will it be more cost intensive efforts to get that group? And how important is it, looking at the Netherlands, for instance, having a resurgence in cases with 49%, I think, fully vaccinated and almost 80% with one dose. So they're having this big resurgence this summer. So how important is it to get this last mile? And is there cost involved?
We're trying. The cost is more our staff trying to figure things out. If we're going to do a lot of the social media stuff, doesn't cost us. A lot of the outreach that we're doing will not cost us. If we need to set up an extra mobile clinic, it's a minimal cost to that. I think that what's happening in other countries we're learning from that. And to me, it is very important that we reach that 75%, that higher level of second dose, because it will, I think, impede or prevent, a fourth wave. And even if we do, our goal is, even if we do get cases that break through, that they're not hospitalized, and that's our goal. I can't guarantee that everybody vaccinated won't develop it, but we will, and we've seen that most people will not get hospitalized, or obviously won't die, obviously, when they're vaccinated. So we're looking at that, but I do think that we're on a trajectory to be able to. But that's why it's important, Amanda, that at the same time, as we're reaching that 75% and getting the last, those 15-20% that are hesitant or lagging, that we still continue being very careful with public health measures. That's why. Okay.
James Morgan, the review is next.
Hi, Dr. Paul.
Hey,
my
James.
question for you is sort of supplementary to one I submitted earlier about vaccine interchangeability. If someone goes to a clinic where both is being offered, are they necessary, and they are about to be given one that is different than what they received the first time, do they have the right to say,
Yeah,
I want this? Okay, so they can.
If we have it available, we'll prefer to give them what they had the first time.
Okay. I just wanted a clarification on that.
It's just when we're short, James, it was, at one point we were short of one versus another. And instead of telling people to come back, in 2 weeks, we think that the interchangeability would just give them their shot quicker. That's all.
Well, I understand. Okay, thank you.
Okay, no problem.
Denis Babin, Radio-Canada is next.
Bonjour, Dr. Paul.
Bonjour, Denis.
Simplement revenir là, justement sur la question concernant les centres de dépistage, me donner les détails, là, pourquoi justement qu'on réduit les activités dans les centres de dépistage.
En effet, on voit le chalandage, les chiffres de tests sont très bas. Il y a à peine des fois quelques personnes qui rentrent, comme Alexandria, à peine. On a un débit de demande qui est très bas. Donc, on veut remettre les employés aux hôpitaux, parce que maintenant, c'est les hôpitaux qui les mènent, retourner à leurs tâches ordinaires, parce qu'on va rétablir les services aux hôpitaux. Donc, vous voyez, et puis on voit ça à l'échelle provinciale aussi. Nos chiffres augmentent très peu, jour par jour, si on compare il y a 6 mois. Donc, c'est pour ça qu'on veut diminuer, on ne veut pas les fermer complètement en permanence, on va diminuer leur présence, leurs heures de travail, si vous voulez, mais ça va être comme un accordion. Si on a besoin de rétablir une débit plus importante ou plus fréquente, etc., on va le faire. Ceci est un plan qui est en discussion avec Santé Ontario Health, aussi de voir qu'est-ce qu'on pourrait faire, pas de les fermer en permanence, mais de temporairement changer leur heure d'opération, et peut-être en mois de septembre, si on aurait besoin, disons qu'on a des cas, puis on a beaucoup de personnes avec les symptômes de rhume ou des choses comme ça, peut-être d'échanger ou peut-être les transformer au centre d'évaluation aussi.
Merci beaucoup, Dr. Paul.
Pas de problème, Denis.
Do those joining by phone have questions? Press star 6 to unmute. Ceux qui se joignent par téléphone ont-ils des questions? Appuyez les touches étoile 6 pour désactiver le mode silencieux.
Good afternoon, Dr. Paul. Bill Kingston, Cornwall News Watch.
Hey, Bill.
Hi there. My first question is you're talking about a lot of interchangeability between Moderna and Pfizer. Can you give me an idea of how much you're using? Is it about a 50-50 mix, or?
I would say 60-40. And
Or
yeah,
60-40 for Pfizer?
yeah, something like that. Yeah.
Okay. And as far as people going to the mass immunization clinics, is there any sort of systematic way of how you're doing it? Or is like the Pfizer being used closer to cold storage, like clinics in Cornwall and Hawkesbury or that area?
No, not necessarily. We base it on what we had given previously and what the second dose looks like in terms of what the first dose was. So let's say we have we know that predominantly individuals had their first dose of Pfizer, then we will ship Pfizer there. If they had first dose Moderna, then we'll ship for Moderna there, or both, depending on the numbers going there.
Okay, perfect. And my follow-up was, you talked about the lagging in the 13 to 30 age group. That period of time that those people have been able to get vaccines has been a lot shorter than the age groups that are a lot older. Are you seeing the rate of uptake over time that it's been open been lagging?
Yeah, we have. I can tell you that qualitatively. I haven't done it quantitatively in my mind, but we have been seeing the rate of uptake is less than we see in older populations. And I can also tell you that I'm seeing the rates go up. They're not going up as high as the more older ones had gone up. And I can tell you that we're seeing this provincially. It's not only us.
Okay, thank you very much.
You're welcome.
Dr. Paul, Amanda Pfeffer has 2 follow-up questions.
Okay.
Sorry, Dr. Paul, just on the WHO, one of the specialists at the WHO today, I think it was today, talked about the mix problem. How should we take that?
What do you mean?
She said one of the experts there said we shouldn't be mixing doses.
I don't personally, I don't agree. I think that the mRNA those vaccines are similar. They're the same technology. They have the same side effect profile. They have the same efficiency. It's not different, Amanda, to switching different types of vaccines that we do it for hepatitis and others. It's just different companies making it. So I don't see why they're disagreeing. At this point, scientifically speaking, an mRNA is an mRNA. And like I said, when we look at other groups of vaccines, there is interchangeability. So I don't see what the issue is with that. We've got other organizations, NACI and others, supporting interchangeability. So I did not hear exactly what the words were from the World Health Organization, but it's certainly not in line with what we're doing and believe here in Canada.
And finally, France they've brought in a mandatory. It's mandatory that you have to get a vaccine if you work in the healthcare sector in France. Do you see something like that here in Canada?
I would not disagree with that. I don't know how we would be able to do that from the legal point of view. I know that we've been struggling with influenza in the past as well. I would welcome something that would promote healthcare workers from being vaccinated. And I think that I don't know that we would do that here, or it would be, it would likely be legally challenged, but I would look at ways of trying to enhance vaccination uptake among healthcare workers, particularly in long-term care. As you know, right now, what we're doing in long-term care is that we need an absolute medical contraindication. And if that individual doesn't have one, then there has to be a course or some kind of a discussion with one of our specialists to ascertain why or why not that individual. So we're trying to make it difficult for people not to be vaccinated, and I welcome that because it's our duty to protect the people that we're dealing with. If you're a physician or a healthcare provider, you're not only vaccinating to protect yourself, you're also vaccinating to protect others that you're treating who are likely in a more vulnerable situation than you are.
Thank you.
No problem.
Do we have any other questions for those joining in by phone? Est-ce que ceux qui appellent, qui sont par téléphone, ont des questions? Looks like that's it for today, Dr. Paul.
Okay, thanks, Nick. Merci.